Okay. All right. Well, thank you, Robert, and thank you so much for having me. I'm really honored that the Medical Society wanted to host this month, and so that we can update the membership on all things advocacy in the Medical Society. Robert mentioned before we started recording, this is being recorded. So for those who are listening after the fact, please feel free to send us questions whenever you like. So my name is Clint Peebles. I am chair of the Msdc Advocacy Committee, and I'm a dermatologist with Kaiser Permanente with the Mid-Atlantic Permanente Medical Group, both in DC and in suburban Maryland. I have a pretty extensive background in advocacy through both organized medicine and specialty societies with the American Academy of Dermatology, where I'm a delegate to the AMA's Young Physicians section, through the Academy, as well as chair of the Academy's Expert Resource Group on LGBTQ health and dermatology. And prior to moving into the district a few years ago, I was with the Wisconsin Medical Society, and prior to that, the Tennessee State Medical Society. So I'm kind of making my clockwise jaunt around the country, but I love DC and hope to be here for a while. And thanks to Robert and Pia and the entire MSDC staff for having me and inviting me to be in this role. It's really been a pleasure. So outline of today's session, we're going to cover a few different things, one being how MSDC takes a position on an issue, advocacy highlights from the last year in 2021, as well as looking ahead to 2022. And then finally, we'll open it up as a forum and hope to hear if there are any thoughts or comments or feedback on our advocacy agenda and items that we might pursue moving forward. So how does MSDC take a position on an issue? And I think this is important because this does lay the groundwork for how we move forward with policy and act on that policy and advocate for that policy. And I think that it can be helpful to have an understanding of this, particularly for folks who may be from other medical societies in other states or in other specialties, for instance, that may have a slightly different process. So in essence, a person has an idea for an issue or a policy position that MSDC should support. That person can be a member of the public, member of the healthcare community, a council member, staffer, executive branch personnel, really anyone and everyone. They contact MSDC staff or an MSDC leader, and that staff member would arrange a call or a meeting to learn more about that particular issue. They'll summarize everything, write up notes, and if appropriate, offer a recommendation. And if the issue is one where the medical society has a position or has taken a position in the past, then staff will act on that issue after informing the MSDC leadership of that. So for instance, a bill to reform prior authorization or regulation adding more CME to license renewals, et cetera. And if MSDC does not have a position on the issue, staff takes the issue to the advocacy committee, which is us. And the advocacy committee considers it, makes a recommendation to the MSDC board, and the advocacy committee meets every other month, and that's when we talk about these important issues. But if the issue is a very time-sensitive one, staff goes straight to the board or the executive committee of the medical society while keeping the advocacy committee leadership informed. So fairly easy to navigate and a very open process where anyone can bring an issue forward and we deliberate and talk about it. So it may be a little bit different from other medical societies, but I think it's a process that's worked well for us, at least in the short amount of time that I've been doing this so far. And we have a wide range of issues that we consider. And so if you have any thoughts, any concerns, any issues you want to bring forward, please don't hesitate to let us know. We're happy to talk about it and consider it. I wanted to mention MSDC's advocacy agenda, and this sets the guidepost for our 2-year advocacy agenda that was approved at last year's December board meeting, establishing the society's advocacy priorities during the next council period. And there are a handful of different objectives and categories of objectives within this advocacy agenda, which you can also find referenced on the MSDC website website. But overall, our prevailing theme is that we want to make the district the best place to practice medicine, looking at providing quality care for all, so advocating for equitable health throughout all the wards, promoting safe working conditions in medical facilities, speaking up for affordable care and insurance practices, promoting public health, so addressing structural racism in medicine, gender parity in medicine, supporting the district's medical schools and training programs, protecting women's health, improving maternal outcomes, and looking at protecting all physician practices. We recognize the diversity of physician practice environments in the district, looking at reforming medical liability laws, helping physicians with addiction and trauma, protecting them from retribution, ensuring medical roles are staffed by appropriate professionals, making prescriptions affordable, reducing opioid addiction, promoting affordable medications, and reducing cost-sharing burdens. And these are just a handful of those priorities, all of which we are consistently working on. And we have some successes with many of these as well, which I will talk about next in our advocacy highlights from 2021. And we very recently had a major win on regional reciprocity. The DC Board of Medicine voted just yesterday that Maryland and Virginia's physician licensing requirements are substantially equivalent to the district's, which has been a longstanding priority for MSDC, been working on this for quite a while. And finally, this will allow DC Health to work with the Maryland and Virginia Board of Physicians to create a reciprocity process for MD and DO licenses, which should certainly relieve many of the burdens and wait times and just overall barriers to licensure in the district when there are reasonable reasons for reciprocity with our neighboring jurisdictions. So this has been a major issue, especially amplified by the COVID pandemic, and we're very excited to see this moving along. More to come in 2022, but this was a wonderful first step. And looking at a few other things, 3 support bills, or bills that we had support for, were approved by the council this year, including flavored tobacco bans, the regulation in midwifery and temporary licensure. The DC budget included 2 MSDC priorities related to funding of various issues, including postpartum coverage funding. We filed a few amicus briefs with the AMA on eviction moratorium that were successful, as well as minor consent for vaccines that were also likely successful. A few other aspects of engagement for us to celebrate. Dr. Alice Fuse testified opposing bill on medical records, and 2 MSDC board members testified in favor of regional medical licenses. We've had members testify at DC Health and oversight hearings, and we've launched our advocacy curriculum as well, which is a great resource for those interested in learning more about advocacy initiatives, how to engage with advocacy, and how to bring your passions of various issues to the advocacy table and make change happen. So definitely reference that advocacy curriculum on the MSDC website. And moving on to what we expect to see in 2022, several things that are shaping up to make 2022 just as busy of a year, if not busier than this one. A bill redefining scope of practice is in the works. Prior authorization and copay accumulator bills, the latter of which regarding copay accumulators was introduced this month, which is one that we have been working on as well. The regional medical license reciprocity, which I just mentioned, that we made some great headway on that in the council yesterday. And so we'll look forward to seeing that further ironed out in the coming year. Public health battles over equity and COVID, something upcoming looking at preservation of Affordable Care Act consumer protections in the district. 2022 elections influencing debates, addressing gender pay gap in medicine, which we are looking at and working working with the Women in Medicine section of the of MSDC and hoping to shed more light on any gender-based disparities in terms of physician pay, treatment, practice environment, et cetera, following along with other states and jurisdictions as well as the AMA on that. And we're working closely to propose some language on that. A bill has been introduced on prohibition of female genital mutilation, which is something that may seem common sense, but there are some issues to be worked out with that. But DC is one of the minority of states and jurisdictions that as of yet does not have any such language on the books. One of the other issues that has come up more recently at our November meeting, we heard concerns about how recent communications from the State Health Planning Development Agency, otherwise known as SHPTA, may suggest changes in the certificate of need process, and that the regulatory language concerning how such processes are prompted with changes in healthcare facilities and other practice aspects may be confusing and result in undue burdens to some practices. So we are learning more about that. We've written a letter asking for further clarification on that, and in the hopes of protecting all of our physician practices, which is one of our core goals. This is an important issue to get clarification on and act if necessary. Another interesting one relates to efforts to revise the Child and Family Services Agency policy on the impact of positive tox screens during pregnancy. And this is a fairly specific issue, but a highly nuanced one with multifold aspects of advocacy to it. In brief, though, there's been a variety of concerns about universal tox screens in the perinatal period, with several issues there, including standard consents and what defines fully informed patient consent, as well as those standards of care on universal testing. And the main issue though here is that tox screens positive for marijuana per CFSA policy will prompt a Child Protective Services investigation. And there are numerous equity concerns about that, particularly given that in the district, marijuana is not an illicit substance. And this policy disconnect, where it's not criminalized in the district, but effectively is criminalized by CFSA policy, can result in further stigma and hardship to already marginalized communities. But there's a lot of aspects to parse out there. The medicine and science of that aside, we just want to make sure that this isn't disenfranchising marginalized populations. And this is just a smattering of advocacy content that we are looking to work on in the coming year and in the years ahead. There will be more to come, but just to get a flavor of the policy that we work with and the diversity of that policy and the opportunities to engage. So whether that be working with the medical society, participating in the advocacy committee meetings, which I encourage everyone to do, and let Robert or myself know if you have any interest or questions about doing that, or testifying on behalf of the medical society in council meetings, et cetera. Please let us know. Let us know if you want to be involved. We're always happy to share all of that. And also we encourage our students and young physicians and residents to be involved as well. The advocacy committee is a perfect and ideal home for medical students and residents looking to get a taste of advocacy work and to get a better sense of what we do outside the clinical environment. And with that, I wanted to turn it over to an open forum and see if anyone has any questions, thoughts, comments, or concerns.